Kimberly Grinston, our Executive Director. Before we get started and I turn it over to Kim, I'm going to go through some general slides about the webinar if you haven't been on one of our webinars before. Everyone is in listen-only mode. If you have any trouble with sound connecting through your computer, on the GoToWebinar toolbar is a phone-in option that you can dial in from a phone if need be. Our webinar today has been approved for 1 hour of CE. You must be signed in individually to GoToWebinar in order to get CE. You cannot be watching under someone else's name and be eligible for CE. At the end of the webinar, I will provide further instructions on how to obtain CE. And just a reminder to everyone that we do not submit CE to the CPE monitor, so you need to save your certificates. We have handouts for today's slides. They're posted on the board's website under the upcoming event link on the left. And then we also have posted them on the GoToWebinar toolbar. If you look on your toolbar, there's a handout section and it should list a PDF there for you to print the handouts if you'd like those or have them on your screen. We do record the webinar. Due to the nature of this one, we'll try to get it posted as quick as possible in the next, either later today or tomorrow. Previous webinars are on the board's website. We did do a webinar on COVID on March 23rd, and there is a recording of that on our website in the news, publication, and resources section if you'd like to watch that. We plan to take questions at the end of our program today. If you'd like to submit a question, go to your toolbar, type it in, and then you can hit send, and we will answer some of those at the end of our presentation today. So we're doing this remotely today, so I'm going to now turn it over to Kim.
Thank you, Tom. And hopefully, as Tom indicated, we are doing this remotely. So hopefully the technology will work with us and everyone should be able to see my screen. Good afternoon, everyone, and thank you for joining us for the webinar. Today, we are going to give just some updates on COVID-19 and some issues and new developments at the board office. I understand that COVID-19 is a very fluid situation and we have a lot of things happening on both the state and federal level. We wanted to reach out to licensees to make sure that you were aware of what's happening at the board and recent statutory rule waivers and other office changes. So let's do that. As we did with our prior call, I'd like to leave as much time as possible for answering questions. We were able to answer a significant number of questions on the last call. So we will walk through some of this information. If you haven't viewed the original COVID-19 webinar, I would encourage you to do that. We will not be walking through all of the detail that we did in the original webinar. We will be providing updates on today, but I think that additional webinar would be helpful. So these are our objectives for the webinar on today. Again, we're going to share just some additional information and then answer some questions. I want to remind everybody that the board has established a COVID-19 page on our website. If you click on that page, you will find board information on COVID-19 updates and resources. General office updates. The board office is open, but we are operating with limited staff. The majority of staff are working remotely right now. However, we do have some staff members in the office and answering calls. Due to volume, we are still asking that you please email the board office before giving us a call. Since we have limited staff, that would be the fastest way to get a response from the board. Our main email address is missouribop@pr.mo.gov. All of our other email addresses are still active, and we have multiple staff members monitoring those. But again, we'd like you to email us if you can, before calling so we can make sure we get to your inquiry as soon as possible. Inspectors are also still working. Their emails and phone numbers are currently online. For those who may not know how to access that, if you go to the board's website, click on board information, and then click on inspectors, it will pull or open a PDF with the inspectors' emails and addresses. All right, let's get into the crux of just some additional licensing updates at the board office. And again, we'll start with licensing. So pharmacist exams, this slide actually needs to be updated. Pearson VUE is now providing limited exams at limited testing centers. If you know people who are on staff, or if you are on the webinar and you need to schedule an exam, their access to exam sites is access right now is extremely restricted. Exam sites that are open are limited to 10 people only. Many of you may know Pearson VUE provides testing services for multiple professions. So we are anticipating delays with scheduling exams. However, NABP and the board, we are still accepting and processing applications. We are still granting authorizations to test. I'm speaking of pharmacists, but that also includes technicians, pharmacies, and drug distributors as well. We are experiencing some delays, but we are still processing those through. We've gotten some questions about new Pharmacy Missouri resident facility applications. So pharmacies and drug distributors located in the state of Missouri, we are still accepting those applications and granting those, and we are still inspecting those. And I'll turn it over to Tom just to give you some more information about inspections.
Yeah, thanks, Kim. Yeah, right now the inspectors are not doing routine inspections, but if you have a new pharmacy or drug distributor, or if you have to do a change of location that needs to be inspected, please go ahead and file your applications as you normally would, and we will work with you on getting your facility inspected. We have gone out and done a few inspections when needed, but do not hold up sending in your application. We've had people inquiring with us on how long they should wait. Don't wait, go ahead and send it in and put the date in there that you plan to move, if it's a change, or when you plan to open, and we will work with you on getting that accomplished.
Someone asked, when the inspectors go back to doing inspections, will we be practicing social distancing? The answer to that question is yes. We will be modifying inspection procedures to make sure both staff and pharmacy staff are safe. Non-resident licensing waivers, we'll talk about that in just a moment, but the governor's office did approve waivers for non-resident licensing and notifications of intent CPR expiration dates. So we are still, and we mentioned this on the original webinar, for those pharmacists who are authorized or who have a notification of intent on file to immunize by protocol or to administer medication by prescription order. The rule does require that you have an active CPR license. We understand that those CPR classes are not being held right now. The board has voted to exercise its enforcement discretion and will not take action if you are immunizing, administering with a notification of intent on file with the board, but your CPR registration has expired. The board is asking licensees to operate in good faith and to complete those classes as soon as reasonably practical. Of course, notifications of intent can still be filed online. So if you have to do that, you can still do so. And those don't expire until your license is eligible to renew. Let's talk about Board of Pharmacy waivers. And I think this is the crux of what we wanted to share today. As many of you may know, the governor's office issued 2 executive orders, Executive Order 2002, which declared a state of emergency, and Executive Order 2004, which authorized the governor and the state agencies to waive or request authority to waive certain statutory and rule requirements. So what I'll walk through are some of the new waivers that have been approved by the governor's office since the last webinar. All of these waivers are available on the board's website, and we would encourage everyone to go to the board's website to look at the full list of all waiver and all waiver language. I've amended the document as of April 15th. If you look at the document now on the board's website, those items that were newly added are indicated in red red. We had some concerns from licensees who couldn't tell what was being added as we walked through the days and the weeks. We are now amending those in red so that you know what is new. Currently, what we have highlighted, the newer waivers are emergency dispensing, and I'll give some updates on that in a moment, non-resident licensing for hospitals, compounding that says sterile compounding, but it should just say compounding, and also substituting albuterol inhalers. Let's start with emergency dispensing. As you know, Section 338-200 authorizes pharmacists to dispense an emergency supply of medication if they are unable to contact the prescriber for refill authorization. The governor's office originally waived portions of that statute to allow, the statute originally indicated a 7-day supply could be dispensed if the prescriber was unavailable. The governor's office authorized a waiver to allow a 30-day dispensing limit that has since been amended to a 60-day supply limit. So once again, you can dispense if there's an emergency, you are unable to contact the prescriber for authorization, you can now dispense up to a 60-day supply. I would reiterate the waiver that was previously granted. The statute currently says that to dispense an emergency supply, you have to be the pharmacy that originally filled or refilled the prescription. The governor's office has waived that as well. The goal here is, we know we have patients who are coming into pharmacies that may not be able to revisit the pharmacy or their personal pharmacy. The goal is to make sure pharmacies are able to take care of patients during the state of emergency. And I need to stress that all of these waivers are during the state of emergency only. Once the state of emergency is ended and the waivers are rescinded, we will provide guidance on moving back to normal regulatory and statutory requirements. Non-resident license portability. The governor's office granted a waiver to allow pharmacists and pharmacy technicians that are licensed in another U.S. state or territory to assist in the state of Missouri. Previously, the governor's office authorized entities that would, or individuals that would be assisting a Missouri licensed pharmacy. That licensure allowance has been expanded to pharmacists, technicians licensed in another U.S. state or territory who may be assisting a hospital or medical care facility in the state of Missouri that is either owned by the state or licensed by the Department of Health or the Department of Mental Health. So what that essentially means is they can assist the hospitals across the state, even though they may not hold a Missouri license. I would note just a couple of things that we mentioned on the original webinar. Once again, they must hold a valid license in their home state or territory. We've gotten questions about inactive licensees who do not hold a valid license or registration in their state and they're considered inactive. That is not considered active and subject to the non-resident license waiver. You must hold an active license or registration that allows you to practice in another U.S. state or territory to take advantage of the emergency waiver. We are asking people to complete an emergency practice notification form. I believe it's a one-page form. There's no fee for the form. It will just tell us who's practicing in the state and where you may be working. If you're working for a relief site or multiple entities, we ask that you just identify one main practice site. Once the emergency practice notification form is filed, you may begin practicing. Missouri pharmacies, if you are allowing a non-resident person to practice under the waiver, we are requesting that you keep proof of their non-resident licensure and also a copy of the notification form in your records. And that proof can be a copy of the license, an online license verification. We're providing flexibility here. Again, we're asking licensees to exercise good faith. This is a sample of the emergency practice notification form. It is different from an application form, so you do not need to submit a full application. Again, it's a one-page form that is meant to be just a shortened process to notify us so that we know who's working in the state. I want to stop and maybe I'll back up for just a moment here. As many of you may know, the governor's office has asked or solicited help from inactive licensees and retirees to help if needed in the event this emergency worsens or we have another urgent healthcare demand. The governor's office will provide additional guidance on how licensing or authorization will take place under that process. For now, though, we are asking you to complete the emergency practice notification form. Some additional licensing questions that we're getting in the office. We've been asked, can you buy medication from another non-resident pharmacy that's not licensed in the state of Missouri? You may need a medication that's not on your shelves, but you know that there is a pharmacy in Illinois who may be able to sell it to you. Currently, and this is under current law, not under a waiver, Section 338, 315.2 allows you to purchase medication from a pharmacy that is licensed in another U.S. state or territory. I want to stress in the U.S. You can purchase and they can ship into Missouri without a pharmacy or drug distributor license, provided that the amount shipped does not exceed 5% of the pharmacy's annual prescription drug sales. That 5% limit is probably familiar for most licensees. So the answer to that question now, even absent a waiver, would be yes. Patient specific, can you contract with a pharmacy that's not licensed in the state of Missouri? And again, we're talking non-resident, to help fill patient specific prescriptions and or to provide assist a Missouri pharmacy with providing pharmacy services? The answer to that question is yes. Again, it's allowed. It's considered a Class J shared service. Now, to accommodate the emergency, and we shared this on the original call, the board is waiving some of the requirements for Class J shared services if you are unable to promptly obtain a Class J permit for both of the pharmacies who are participating in sharing pharmacy services. Right now, the rule requires things such as a common database if you're not under common ownership, written contract or policy and procedure manual that must be in place prior to doing Class J activities. That is waived during the state of emergency. Again, the goal is to take care of patients here. We want to make sure that we do that as seamlessly as possible. Can you buy medication from an unlicensed distributor? There's some confusion about this right now. Currently, drug distributor licensing requirements have not been waived at this time. If they are shipping as a drug distributor into the state, they still need a Missouri drug distributor license. However, I would note there are several exemptions in our current rule 220-5.020. You see those on your screen. One exemption being emergency administration to an individual patient. So if a med is being shipped in for emergency administration to an individual patient, and a delay in getting the therapy would negatively impact the patient, the drug distributor licensing requirements are waived to the extent medication has to be shipped for the emergency. Hospitals and healthcare entities, current law, this is not a waiver, but current law allows transfers between those entities if they are under common control or ownership. I would suggest you talk with legal counsel, read the rule for the definition of what common control or ownership may be. And then shipments from an FDA registered manufacturer to alleviate a temporary shortage. And I think this may be one of the issues that probably will come up, but our drug distributor laws do currently allow an exemption to licensure if you're receiving a product from an FDA registered manufacturer and the product is unavailable due to a shortage or interruption in supply. The next waiver that I wanted to mention was compounding, and for this one, I'm actually going to ask Tom if he can walk you through it.
Okay, so the board got approval for a waiver and this applies to hospital pharmacies, and you see at the bottom a definition of what a hospital pharmacy is. It includes hospitals licensed by Department of Health or Mental Health or operated by the state, and it also includes their Class B pharmacies. Not just the hospital itself, but any of the Class B pharmacies that it has. And it will allow these pharmacies to compound non-patient specific items for use in treating and send to other hospitals for the treating of COVID-19 patients or patients who may have been relocated to other facilities due to the state of emergency. And it will also allow them just to assist in helping any other hospital out who is having trouble performing their own compounding at the time due to whatever reason to the state of emergency, such as their staff is out or they're out of a PPE or whatever it is. So it will allow hospitals basically to do non-patient specific compounding for other hospitals. It does not apply to pharmacies that are not hospital or Class B. So there is a limit, and you still would need to follow all the other rules in the compounding rule of keeping a log. And on that log, it talks about putting the prescription number. You won't have a prescription number for that. I would just document that it's a COVID-19 distribution would be sufficient in that field of your record. And that would be it on that one, Kim.
Sure. Well, then why don't you also do the next slide, Tom, to talk about substitution of albuterol inhalers. This is a new waiver that was approved on last week, so this will be our first time sharing this information.
So the board requested a waiver to allow pharmacies to substitute among the albuterol inhalers that are out there on the market. As you're all aware, there's actually 3 brand names that are out there, but they're all rated B to each other in the Orange Book. The board got approval to allow pharmacists to substitute with a product that does not have the same rating, so you would be able to substitute among them with B-rated products. So this would mean that if you're unable to get a certain brand in, but you have another one, you would be able to substitute it without calling the prescriber to get authorization like you would normally. If the prescription is written, dispense is written, or has any indication on it that it requires brand name, you would still need to call the prescriber for authorization to substitute that. But for ones that have substitution allowed, you would be able to use any of the albuterol inhalers listed in the current Orange Book. It would also apply to existing prescriptions. So if the patient has been on one brand, but due to a shortage, you're unable to get that, you would be able to substitute that for that, as long as that prescription was not written with any indication of brand name or dispense is written. And so this only applies to albuterol sulfate. It does not apply to Combivent or any of the other combination inhalers that are out there. Okay, Kim, that would be it for that one.
Got it. So again, that's just a summary of the newer waivers that have been issued as of the last week or since the last webinar. I would encourage licensees once again to monitor the board's website. There are other waivers that have already been approved, including remote data entry, remote product verification. There's some language for prescription transfers. Also, sterile compounding, aseptic skill assessments. Please go back to the original waiver document or the joint waiver document, and all of those will be listed. Again, the new waivers are identified in red. Some other updates from the board that are not directly related to waivers. So we have had multiple questions about pharmacists providing COVID-19 testing. The board issued a statement on COVID-19 testing on last week, April the 13th, in consultation with the Missouri Department of Health and Senior Services. That is on the board's COVID-19 webpage as well. Encourage licensees to read that full statement. I'll do just a little summary of what the statement provides. Currently, as you may know, the Federal Department of Health and Human Services granted pharmacists authority to order and administer COVID-19 testing. Section 338 or Chapter 338 does not prohibit a pharmacist from ordering and administering COVID-19 testing. The board's rules don't address this, so we would advise, and the board has recognized, that pharmacists have authority to order and administer COVID-19 testing as authorized by HHS. The board recommends that pharmacists should be appropriately educated and trained and competent to perform the services provided. The board also recommends that licensees comply with professional standards of practice. The board recommends that licensees document the patient care services provided, so who or whom you may be testing. Also, patients should be referred to their primary care providers for additional treatment or medical care when appropriate. So the board has been asked a lot of questions about COVID-19 testing and specifically training already. The board can't make any recommendations on any specific tests or the type of training that would be appropriate, but I will show you some resources that are available on the board's website that may provide some additional guidance. Intern pharmacists may assist with COVID-19 testing under the direct supervision of a pharmacist. This is current law. Intern pharmacists are able to operate under the supervision of a pharmacist. That would remain unchanged for COVID-19 testing. COVID-19 testing is a non-dispensing function. It doesn't have to be or can be performed outside of a licensed pharmacy. We had some questions come in about whether COVID-19 testing could only be performed within the physical pharmacy. This is a non-dispensing activity, and for sanitation, safety reasons, it may be advisable not to do it within the physical premises of the pharmacy. A lot of entities have set up drive-through testing and things off-site in lieu of having those patients come into the pharmacy itself, but it is a non-dispensing function that can be performed outside of the pharmacy permitted area. An MTS certificate is not required. We had some questions about this. You do not need an MTS certificate. Under Missouri law, an MTS certificate is only required if you will be changing or modifying medication therapy. That is not the case with COVID-19 testing, and so MTS certificate is not required. Of course, the board recommends that staff have on personal protective equipment. We understand that is in short supply, but we believe in line with CDC recommendations that is the safest practice. And pharmacies and staff should be practicing proper sanitation, disinfection, and cleanliness as recommended by the CDC. Specifically, CDC resources. So there are several CDC resources that are out for pharmacies right now. The main one being number one, considerations for pharmacies during COVID-19, during the COVID-19 pandemic. That has a lot of information that would be helpful. We're going to talk a little bit about that some more in just a moment. However, there are also guidelines on collecting, handling, and testing specimens, evaluating patients who are coming for testing, PPE recommendations. All of these resources are available on the board's website. The board cannot give additional guidance on this. However, the board does recommend that you follow CDC guidelines as the professional standard of practice. The Department of Health and Senior Services has indicated that a CLIA waiver, so these tests, the ones that are approved now, I believe there are 2 tests that are currently CLIA waived tests, and a CLIA waiver from the state of Missouri would be required, actually from the federal government, would be required to provide that testing. I think there are 3 tests altogether, including one being an antibody test. The Department of Health and Senior Services administers the state CLIA waived program, and their information is available in the guidance document that was posted on the board's website. They are expediting applications for CLIA waivers. I am told that that can be done very quickly. Many of the pharmacies and some of the hospitals may already have a CLIA waiver. In that case, nothing new. Our understanding would be required. But we would send you to the Department of Health and Senior Services for additional information on that. The Department of Health has issued some guidance on what to do if you have a patient that tests positive for COVID-19. It is attached to the statement that is currently on the board's website. So again, we would refer you to that document. This is just a screenshot of the beginning of that document, but it does provide some direction on what pharmacies in Missouri should do if you do have someone who tests positive for COVID-19. We've received questions about pharmacy safety and staff wearing PPE. We've received inquiries from absolutely everywhere, from patients visiting the pharmacy, from pharmacy staff who are uncomfortable working without PPE, from pharmacy permit holders. The board issued a statement on this on April 7th, 2020, basically recommending best practices and also adopting and or recommending CDC's considerations for pharmacies during the COVID-19 pandemic. That the CDC has a plethora of resources on their website. If you haven't been on the website, I really would encourage that you do so. But they have specific considerations for pharmacies, including PPE suggestions, sanitation suggestions. They address questions like what should you do if you have a staff member test positive, or if there is a suspected or confirmed case of COVID-19 in the pharmacy. A lot of those questions are addressed in the CDC's guidelines, which again, the board is formally recommending. That document was revised on April 14th of 2020. You'll see just a snapshot of their revisions on the screen right now. One of the recommendations in the revised guidance or considerations for pharmacies would be that pharmacy staff wear face masks at a minimum, and also that the public wear face masks as well, with exceptions for children and those who may have additional or special circumstances that would make wearing a face mask probably not appropriate. They are recommending that pharmacies postpone routine clinical preventive services such as adult immunizations. That is not a mandate from the board, but it is a recommendation from the CDC. And then they also included some special considerations for pharmacies that are co-located in areas that have a clinic. So once again, we would recommend that you go to the board's website. This document is posted there, but there's also a link to the CDC's website as well. Additional updates. This is just a reiteration because we continue to get calls on compounding hand sanitizer. The board has determined that it will exercise its enforcement discretion. Pharmacies, drug outsourcers can compound alcohol-based hand sanitizer for over-the-counter use in compliance with FDA guidelines. We mentioned this on the last webinar. The FDA issued their guidance, I believe is at the end of March. That document was updated on April the 15th. So if you haven't seen any of the new updates, I would encourage you to do that. If you are compounding 20 under 2.400, you should be recording it in your compounding log. And you can include OTC use where you would normally put a prescription number because you wouldn't have one in this case, but please remember your compounding log requirements. I think this may be close to our last slide before we move on to questions. We have gotten notices from pharmacies that are temporarily closing. Some of it is just preventative and they are closing just as a safety measure. Other pharmacies may have had staff who are suspected to have been exposed to COVID-19. We are asking licensees to do several things. Number one, notify patients so that patients know where to go and how to get access to their medical records and or transfer or ask questions if they need to. We're also asking that you notify the board office, and you can do that by emailing MissouriBOP@pr.mo.gov. Actually, if you email any of the board's email addresses, that information will be forwarded to the appropriate person. Provide contact information for both the board and patients just in case we get a call or patients want to contact the pharmacy. And then finally, please provide as much advance notification as possible. Of course, we understand there are situations where that just is not, it's unlikely to happen, but if you can, if you know the pharmacy will be closing temporarily in the next 2 days, 3 days, it would be great to provide as much notice as possible. For the few pharmacies who have had to unfortunately close temporarily, many of them have placed signage on doors and public access areas, drive-through windows, informing patients in advance that the pharmacy will be closing and/or modifying hours. I think that's an additional suggestion that would be helpful. So patients, if your pharmacy is changing hours, and we've had several pharmacies do that, and patients will not be able to come in at 9 p.m. or 6 in the morning like they normally would have or would have been able to, our recommendation is that you post that, please, in a public place so that patients know and can make proper arrangements in advance. Okay, those are generally our updates for this webinar that we wanted to go through. I know that was a lot of information all at one time. At this time, we are going to start looking at questions. And again, we'll try to answer as many as we possibly can on the call today. We are scheduled to be here until 1 o'clock, which gives us about 25 minutes to answer questions. Tom and I will tag team some of the questions that you send in. Once again, Tom, if you can walk everybody through the process of asking a question, and we'll just go through those in the order received.
So on your GoToWebinar toolbar, there's a questions field. You can type it in there and hit send, and we will get it, and we will see what we can do about answering it. Kim, I'll go ahead and start off while you get a chance to look at some of them. We did get a message from BNDD that if you have any controlled substance questions, you can email them to bndd@health.mo.gov, and they will respond to you. We have someone asking about, is ProAir RespiClick something that can be substituted under the waiver? And the answer is no. The reason is the waiver is specific to aerosol metered dosage form, and the RespiClick is a powdered, metered powder. So no, it does not apply to that. And I just want to go back to the waiver. In order for that to apply, you have to be out of the inhaler that you should be using, and that's when the waiver kicks in. You just can't automatically start substituting because that's the one you choose to do. You have to be out of the one that was ordered. We have someone else asking about the albuterol inhalers is, if you do substitute, do you have to switch back when the waiver is over? The answer would be no, that once you make the switch, it would be good for the life of that prescription. And I just would caution everyone to make sure you're advising the patients if you're making a switch to something that they were on previously to a different inhaler. Make sure they're aware of that and get counseling if they need be.
Someone is asking, Tom, can immunizations or injections be given outside the physical facility of the pharmacy? For example, curbside, yes. The answer to that question is yes. That is current law. If you have a notification of intent on file, you can do that outside the physical premises of the pharmacy.
However, if you're doing it by protocol, your protocol needs to say that. So you may need to amend your protocol if you're doing vaccines based off a protocol to put the location that it's outside of the pharmacy there.
Someone is asking if it's legal for a pharmacy to lock their doors and operate as curbside and drive-through only. The board's rules don't prevent that. We would recommend, if you're going to do that, that again, you give patients as much notice as possible. And of course, you still have to comply with all patient counseling requirements that currently exist in law. But yes, if you choose to operate curbside or drive-through only, pharmacies are authorized to do that.
We have someone asking about if your CPR is expired or going to be expired, can you still do it if there's someone present who is? And the answer is yes. As we said earlier, the board is using enforcement discretion. If you cannot get your certification renewed due to COVID reasons, you can continue to immunize and give administrations, but you need to get that completed as soon as possible once the state of emergency is over.
Someone is asking, do face masks need to be worn by all pharmacy staff if we are using drive-through only? The board, right now, the board does not have a requirement for face masks. However, the CDC is recommending that pharmacy staff use face masks, and the board has approved those recommendations. So while the recommendations are not mandatory, that is the board's recommendation of best practice. This would be determined by pharmacy staff, by permit holders. So it's not required by the board, strongly recommended, and it would be in line with CDC guidelines. I would note, though, that our rules do require that pharmacies be maintained in a clean and sanitary condition. And to the extent that there is a condition at the pharmacy that could pose a risk to patient health, that may be an issue. But as of right now, we do not have something that specifically mandates wearing face masks.
People are asking what type of mask. We don't have any specific guidance on that, but I did hear on another webinar I did recently that cloth masks should not be worn by people who are coming in known contact with people who might be positive. So that possibly could be people waiting on customers. So we don't really have guidance on that, and I would check with the CDC or maybe the local health department if you have questions about that. And another person's asking if these masking requirements apply to hospital pharmacies. My understanding, the CDC guidelines are for those that are coming in contact with the public, is who they apply to.
Someone has asked, is there a delay in processing technician licenses? Yes, there is a delay, but it is a minor delay. So those applications that are coming in as complete, we are processing right now. For those who may not know, generally the office issues a technician registration, assuming that we have everything we need within 5 to 7 days. I would estimate that we are now probably up to a 10 to 14 day window, and some of that is because of mail handling and delays on the mail. However, I would note once again that technicians are authorized to begin working once a completed application has been submitted to the board office. The board has allowed technicians to begin working if they are unable to be fingerprinted, but they have registered for fingerprinting. We will consider that complete during the state of emergency. However, the tech registration will not be issued until they are actually fingerprinted. So yes, there is a slight delay in processing. Again, I think we may be somewhere between maybe 8 to 10 days right now, but I would suggest allowing at least 2 weeks for those applications that come in as complete.
We have a couple questions on the 60-day supply for emergency prescriptions. Someone wants to know if that applies to controlled substances. No, it does not. At this time, there is not a waiver that applies to controlled substances for that. And someone else is wanting to know, is it okay to bill insurance for these prescriptions? These are valid prescriptions in the eyes of the board if you follow the statute. And so they would be just like any other prescription. We can't give billing advice, but they are valid prescriptions just like any other prescription a patient might have.
Someone has asked about technician renewals. Since there are no paper licenses being printed at this time, what documentation is needed? You can always use the documentation from the board's website. You can print off a license verification from there. Hopefully, we will begin mailing paper technician renewals or new registrations within the next week.
We have some COVID testing questions. Is there a restriction for distance from the physical pharmacy? The Board of Pharmacy does not have any regulations related to that. And they want to know, is there guidance for submitting insurance claims? Again, the board does not provide guidance on insurance billing. You might reach out to the association here in Missouri to see if they have any guidance for pharmacies on that.
So we have someone asking about guidance for graduating pharmacists who are unable to sit for their boards at this time. We do anticipate issuing, actually had a conference call with the schools on today, Missouri schools on this morning. We will issue some additional guidance probably shortly. However, right now we are still able to receive applications and we are processing those. We are authorizing applicants to test. And hopefully we'll be able to accommodate and get some additional time or a faster date to sit for the exams, please stay tuned for that. We have been working with NABP, ACPE, ACPS, and the pharmacy schools to make sure we can get our graduates tested as soon as possible.
Someone's asking, has technicians renewals been mailed out? The answer is yes, they went out, I believe, the first part of March. So if your technicians haven't received one, they should email the board office and request a duplicate renewal if they haven't received it. Let's see. Someone's asking, are there guidelines for sterilizing and reusing N95 masks? The board does not have any. I would suggest you check with the FDA and CDC for guidance on that. Someone's asking, has there been any changes to CE requirements? No, there has not. A renewal period for pharmacists will be this fall again. So no, current 30 hours will be required to renew your license by the end of October.
Someone has asked, can pharmacies who have a CLIA waiver administer COVID-19 testing that may be approved as a CLIA waived test? Health and Human Services has authorized pharmacists to order and administer those tests. Department of Health, Missouri Department of Health and Senior Services has indicated that yes, pharmacies who have a CLIA waiver may order and administer those tests in compliance with federal guidelines. I would suggest you contact the Department of Health and Senior Services to see if any additional requirements apply. My understanding from the Department of Health right now is that there aren't additional requirements if you currently hold a CLIA waiver.
I need to clarify an answer I gave on the waivers for emergency fill. BNDD did get a waiver for a 14-day supply for controlled substances. That is, there is, I believe we have a link to that on the board's website for that, but it does allow for a 14 days of emergency medication. So it's going to be much less than what the board allows, but there is one for controlled substances.
Someone has asked, is it required for an owner to notify employees about a COVID positive employee? That's not something that the board can give guidance on. That really would be a labor law and also a confidentiality issue. So I would suggest that you contact your legal counsel. However, if you do know that you have an employee that has tested positive, in accordance with CDC guidelines, the board does recommend that you follow CDC's recommendations. And number one, try to determine the extent of exposure to other pharmacy staff and also patients. Also follow proper sanitation, cleaning, disinfection procedures to make sure that you aren't posing a risk to other pharmacy staff and or patients. But we can't advise on whether you are required to notify other employees that a staff member, a fellow staff member has tested positive.
So follow-up question on the BNDD waiver. They're asking, is it for all control schedules? And according to, it appears it is all schedules. It does specifically say you have to verify that the original pharmacy is closed or unable to fill the prescription due to the state of emergency. And then it goes on to require that you provide notification to the prescriber within 7 days of dispensing the emergency supply. Again, we have a copy of this on our website, and BNDD has it on their website also. Someone's asking about insurance overrides. The board cannot provide you any guidance on that. I recommend you reach out to the association if you have an insurance question, and maybe they could assist in answering that for you.
Someone asked if the board has data on how many pharmacists and technicians have become infected. I'm sorry, we don't. If anyone has it, though, I would be interested in seeing it, but we don't. Someone's asked, when do we think the class of 2020 pharmacists will be licensed with the testing delays? This is good for graduating pharmacists and also employers to hear. We're not sure right now. The board will do everything that they can to get our graduates licensed as soon as possible. Again, I met with the school this morning to discuss other options to see if we can get our licensees, our graduates through the process as soon as possible. I will be quite frank, we are hearing testing delays right now that may extend to July, August, and September. So worst case scenario, we are told that there may not be testing dates available until the fall. The board again is trying to accommodate that. We are working with NABP about other options that we can use to make sure or to have our students tested as soon as possible. We'll let everybody know once we get additional information on that.
Someone's asking, is it recommended for pharmacists and staff to wear gloves while on duty? I believe you have to look at the CDC recent update. I don't believe it mentions gloves, but I can't tell you that for sure. I would suggest you look at that document. Someone mentioned that CDC preferences for surgical masks for pharmacy staff, and someone asked what kind of mask should be worn. So again, I would recommend everyone look at the CDC guidance when it comes to PPE on what pharmacy staff should be wearing.
Looks like we're getting to the end of questions. We don't want to leave anyone out. If you have a question, please enter your question in the question box that you see on the screen. We must have a lot of new graduates on the phone. Someone is asking about the class of 2021 and if there will be a delay. Once again, I just met on that this morning. So we are aware that COVID-19, despite what may happen in the next couple of weeks, may have some impact on the class of 2021. We've talked with Missouri's pharmacy schools, and we are already beginning to look at ways to address that. So I would tell the class of 2021, hopefully everything will run smoothly as it normally does, but please stay tuned, and we'll let you know if there's anything else that you need to be aware of.
So someone's asking about when you're doing emergency dispensing, does the prescriber say the same or does the pharmacist become the prescriber? Now, the prescriber would say the same. The pharmacist is not the prescriber on those prescriptions. Someone's asking for a reminder on CE, when CE is due for your renewal, for pharmacist renewal in October. So the dates that CE must be completed by is November 1st, 2018 through October 31st, 2020. And there's been no change to that. It's the same as it's been for quite a while.
I would note that for this webinar and the last webinar, we had such a large volume of people on the COVID-19 webinars that we are sending out CE certificates via email right now to the email that you use when you registered for the webinar. If you need a CE certificate with your name on it for another state or for another reason, you will need to contact the board office to let us know that. Right now, with mail not being delivered and or sent out by the state in large quantities, sending out, it just wasn't possible to send out 900 CE certificates, but you should have received, if you were on the last webinar, the same will be for this webinar, something via email confirming your attendance and also granting CE registration if you complete the CE exam that's going to come up at the end of the webinar that Tom will tell you about.
Someone's asking what kind of documentation you need for an emergency prescription. I would just document on the prescription or somewhere in the prescription record that that you attempted to contact the prescriber and that you were not able to. And this prescription was based on the COVID-19 emergency dispensing waiver.
Again, this is a licensing question we've been asked. Will the board be adjusting the number of intern hours required to sit for the board exams since many rotations were canceled. We have confirmed with Missouri schools, we believe that all graduates who are scheduled, the class of 2020, you all have the minimum number of required intern training hours right now to graduate. Confirm that with the schools this morning. For those individuals coming from other states, contact the board office. While the board hasn't changed the number of intern hours right now, we want to make sure that you are reporting all hours that Missouri will give you credit for. So for students, you guys have both IPI and API hours. Some schools may not always report the IPI hours, and we've been able to work with some of the schools to include those hours to meet Missouri's requirements. So if you think you may not have enough hours, contact the pharmacist desk and we'll reach out to you and see what we can help you with.
So, someone's asking for clarification on the substitution of albuterol inhalers. Does that only apply when you're unable to reach the provider? The answer is no. The reason the board asked for this waiver was due to the shortages. It would allow you to go ahead and make a substitution without seeking prescriber approval to do that. So the answer is no, you don't have to wait until you're unable to reach them. But the inhaler that you're switching from must be unavailable for that waiver to kick in.
Someone is asking, would a test and treat protocol be allowed pursuant to a positive test once a treatment is approved? That's something that we would have to take back to the board. Of course, we have certain things in our law right now, including MTS. Right now, Missouri law doesn't authorize a pharmacist to treat, but there may be, as commonly defined, but there may be some things in our current law that would address that. Also, the governor's office has approved waivers, and I think that may be something that the board would like to review to see what would be allowed if there is a treatment that is approved. So stay tuned. Hopefully there will be a treatment approved soon.
Someone's asking for clarification again on the PPE requirement for those entering a pharmacy. Is that retail or hospital? It's my understanding that is a retail, but again, that's a CDC guidance. I would tell you to go to the CDC website to get the answer for that. People wanting to know, are there pharmacies doing testing? I'm not aware of any, but again, they're not required to let us know that. I've seen reports that it's going on in other states, but I'm not aware right now if there's any, and I don't know if if the office has had any notice of that.
Not right now.
Yeah. Someone's asking about CE credit. I will go over in just a minute on what you need to do in order to get your CE credit.
There's a question, does the board require the pharmacy to close for deep cleaning if someone in the pharmacy tested positive for COVID-19? Again, the board's rule says that pharmacies must be maintained in a clean and sanitary condition. If closing the pharmacy for a deep cleaning is required to ensure that patients and pharmacy staff are adequately protected, then that would be required by the rule if you assume that that is necessary.
Someone wants clarification if they did not receive their certificate for the March 23rd webinar that we emailed out. First, I want to clarify there was no attachment to the email. It was just an email saying that you completed the webinar. If you didn't get that email, you can email compliance@pr.mo.gov and just ask them to resend you the March 23rd email.
Tom, I think it looks like we are just about at the end of our questions right now. All righty. Well, I'm going to turn this back over to Tom to wrap up the webinar and go through the CE requirements at the end of the webinar. Thank you, everyone, for joining us for this webinar. We understand, we have heard, I know many of you are getting multiple e-alerts from the board office, and information is coming in from a lot of places. As you know, this is a very fluid situation. Again, we want to make sure we're getting you as much information as we can, as soon as we can. Thank you all for your patience with the board office and board staff as we work through working remotely and still trying to keep Missouri up and running. I think on behalf of the board, I would caution licensees and again, just advise you to make sure that you are continuing to do everything that you always do. I don't know how many of you are signed up for the Department of Insurance's Twitter postings, but they sent out a thank you to pharmacists, to all of the pharmacists who have been working the front line as you always are. Thank you for everything that you do to help Missouri patients. And we want to make sure as a board that we are empowering you to do that. And if there's something that is standing in the way of you being able to take care of patients due to COVID-19, we'd love to hear about it. Please email the board office and let us know. And a lot of the waivers and a lot of the issues that we've addressed have come from licensees who just let us know that this is creating a problem in the industry. We can't fix everything, but we definitely will pass it on to the board. I believe the board has worked very diligently. I think they've met weekly, if not multiple times per week for the last 3 to 4 weeks. The board met on last week, Friday, I believe it was, and they're meeting again on Wednesday of this week. So the board is aware of the issues, and we're trying to address as much as we can, as quickly as we can, so that we can get out of the way and allow you to continue giving good patient care. With that, Tom, again, thank you, everyone, and Tom will give you instructions on wrapping up the webinar and getting CE.
Before I do that, I just want to tell you that we did have to postpone the B&ED webinar that we were going to do in March. We will reschedule that once the office gets up and running again. And we still have planned on May 21st a webinar with Josh Moore, the director of the pharmacy department at Mo Health Net, and he will be here hopefully as planned, but that is still scheduled to go. So to receive CE, you must complete the post survey. In order to get that, do not close your browser. When I will announce I'm closing the webinar, you should get a little box that comes up that says that I've ended it, and it will go to a webinar will exit. You hit close. Again, do not close your browser because a survey will pop up on your browser. Answer the questions and click submit. If you do not receive the survey, and we understand some mobile devices, tablets, and phones may not automatically pop up, if you don't get those, you can email us at compliance@pr.mo.gov, and we will email you the questions. If we do that, you have 24 hours to get your answers back to us. And again, we will send out some type of email to you for credit. That email will not probably come for 2 to 3 days, so don't be expecting it today. So I want to thank everyone for attending the webinar today, and I'm now going to close the webinar.